Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about body weight and more specifically, why aerobic exercise can be one of the most useful tools for people carrying extra weight. Start with this idea. Weight is not just a number on the scale. It is connected to hormones, appetite signals, sleep, stress, muscle activity, blood sugar control, blood pressure, liver fat, joint load, and daily energy use. So when someone says, just exercise more, that can sound too simple. And honestly, it is too simple if we do not explain the why and the how. So look at aerobic exercise not as punishment for eating. Do not use it as a way to burn off guilt. Think of it as a medical signal to the body. Walking, cycling, swimming, dancing, jogging, using an elliptical, or doing water aerobics all send repeated messages to your heart, lungs, blood vessels, muscles, and metabolism. Why does this matter? Because extra body fat, especially around the abdomen, is not only stored energy, it can be metabolically active tissue. It can contribute to inflammation, insulin resistance, higher triglycerides, fatty liver changes, sleep apnea risk, joint pain, and higher blood pressure. Not everyone with extra weight has the same risk, and body size alone does not tell the whole story. But as a doctor, I want you to ask better questions. How is your waist changing? How is your blood pressure? How is your fasting glucose? How is your energy during the day? How is your breathing when you climb stairs? Aerobic exercise helps because it uses large muscle groups repeatedly over time. When your legs and hips move during a brisk walk, your muscles pull glucose from the bloodstream. They burn fatty acids, your heart pumps more blood, your blood vessels learn to relax more appropriately. Over weeks and months, your cardiorespiratory fitness improves. That improvement matters even if the scale moves slowly. Pay attention to that point. The scale may not immediately reward you, but your body can still be changing. Your resting heart rate may improve. Your blood pressure may come down. Your walking distance may increase. Your waist may shrink. Your blood sugar may respond better after meals. Your mood and sleep may improve. These changes are not magic, they are physiology. Now ask yourself, if aerobic exercise burns calories, why doesn't everyone lose weight quickly from it? Because the body is adaptive. Some people become hungrier. Some people move less later in the day without noticing. Some people overestimate how many calories exercise used. A 30-minute walk is excellent for health, but it does not cancel a large high-calorie meal. So use aerobic exercise as part of a system, not as the only tool. Start with food quality and portion awareness. Add sleep, add stress management, add resistance exercise if you can. But today, keep our focus on aerobic movement because it is accessible, measurable, and powerful when repeated. Public health guidance commonly recommends at least 150 minutes per week of moderate intensity aerobic activity for general adult health. That could mean 30 minutes, 5 days per week. For more weight reduction, clinical exercise guidance often moves higher, commonly toward 225 to 300 minutes per week or more, depending on the person, food intake, medical conditions, and starting fitness. Why does the dose matter? Because weight loss requires a sustained energy gap, and larger weekly movement volume can help create that gap. But do not jump from 0 to 300 minutes. That is how knees flare, backs tighten, feet hurt, motivation collapses, and people quit. Do this instead. Start where you are. If you have been inactive, begin with 10 minutes of walking after one meal each day. Do that for a week. Then add a second 10-minute walk on some days. Then build toward 20 to 30 minutes. If your joints hurt, use cycling, swimming, or water walking. If your balance is poor, use a treadmill with handrails or walk with a partner in a safe place. If you feel embarrassed exercising outdoors, start indoors. march in place. Use a stationary bike. Walk a hallway. The body does not require a fancy setting to adapt. Now let's define intensity in a practical way. Moderate intensity means your breathing increases, but you can still speak in short sentences. You should not be gasping. Use the talk test. If you can sing, you are probably going too easy for a training effect. If you cannot speak at all, slow down. For many people, brisk walking is enough. For others, brisk walking may be too hard at first, and that is okay. Start with comfortable walking, then gradually increase pace. Why does moderate intensity work well for many people with extra weight? Because it can be sustained. It is less likely to create excessive soreness. It can be repeated often, and consistency beats heroic effort followed by 3 weeks of doing nothing. Now look at the weekly plan. Do not make it complicated. Choose 5 days. Put them on your calendar. Treat them like appointments. Start with 20 minutes if you are able. That gives you 100 minutes per week. Then move toward 30 minutes on 5 days, giving you 150 minutes. After that, if weight reduction is still a goal and your body tolerates it, build toward 45 minutes on 5 days or add a longer session on the weekend. Ask yourself, what is the smallest plan I can repeat even on a difficult week? That question is more important than the perfect plan. Aerobic exercise also helps with appetite regulation for some people. Not everyone responds the same way. Some people feel less cravings after regular activity. Some feel hungrier at first. If you are hungrier, do not panic. Plan your food. After exercise, choose protein, fiber, and fluid. For example, eggs and fruit, Greek yogurt, beans, fish with vegetables, chicken with salad, or tofu with whole grains. Do not finish a walk and reward yourself automatically with ultra-processed snacks. That habit can erase the energy gap very quickly. Hydration matters too. Sometimes thirst feels like hunger. Drink water before and after exercise. If you have heart failure, kidney disease, or you have been told to limit fluids, follow your clinician's guidance. Now let's talk about visceral fat, the deep abdominal fat around organs. Aerobic exercise can help reduce waist size and abdominal fat even when total weight loss is modest. Why? Because active muscle changes how the body handles fuel. Over time, your muscles become better at using fat during activity and better at storing glucose as glycogen after meals. This can improve insulin sensitivity. That is one reason movement is so important for people at risk for type 2 diabetes. Look at blood pressure. During exercise, blood pressure rises temporarily because your heart is working. But with regular training, many people see better resting blood pressure control. Blood vessels become more responsive. The nervous system may become less overactivated. This does not mean stop your medication. Never stop blood pressure, diabetes, heart, or cholesterol medication because you started exercising unless your healthcare professional tells you to. But do monitor. If numbers improve, your clinician may adjust treatment safely. Now, safety. This matters. If you have chest pain, pressure, fainting, severe shortness of breath, a new irregular heartbeat, pain spreading to the jaw or left arm, or sudden weakness on one side of the body, stop and seek urgent medical care. If you have known heart disease, uncontrolled blood pressure, severe asthma, advanced kidney disease, diabetes with complications, severe joint disease, or you are pregnant, ask your healthcare professional how to start safely. If you use insulin or medications that can lower blood sugar, learn how to prevent exercise-related hypoglycemia. Carry fast-acting carbohydrates if advised. Check your feet regularly if you have diabetes or nerve problems. Pay attention to pain. Muscle effort is expected. Sharp joint pain is not the goal. Foot blisters, worsening knee swelling, hip pain that changes your walking pattern, or back pain with numbness should be evaluated. Do not push through warning signs just to hit a number. What about high-intensity interval training? It can help some people improve fitness and use calories in less time, but it is not the best first step for everyone. If you are new to exercise, build a base first. Walk consistently. Improve your breathing. Strengthen your routine. Later, you can add short, faster intervals, such as 30 seconds quicker, then 2 minutes easy, repeated several times, but earn that progression. Let's make this practical. Day 1, walk 10 to 20 minutes at a comfortable pace. Day 2, repeat, but add one small hill or a slightly faster final 5 minutes if you feel well. Day 3, choose low impact movement like cycling or swimming. Day 4, walk again. Day 5, walk after a meal, especially after dinner if that is safe in your neighborhood or possible indoors. Over time, aim for a rhythm, 3 to 5 aerobic sessions weekly at first, then most days of the week if your body tolerates it. Spread it out. You do not need to suffer, you need repetition. Now ask, how do you know it is working? Track more than weight. Measure waist circumference every 2 to 4 weeks. Track resting heart rate if you have a device. Notice how long it takes to climb stairs. Watch your blood pressure if you monitor at home. Look at lab changes with your clinician. A 1C, fasting glucose, triglycerides, liver enzymes when relevant. Notice sleep quality. Notice mood. Notice whether cravings change. If the scale is stuck after several weeks, do not assume exercise failed. Look at food intake, liquid calories, alcohol, sleep duration, medications, and medical conditions. Some medications can promote weight gain, including certain steroids, insulin regimens, some antidepressants, some antipsychotics, and some seizure medications. Do not stop them on your own. Ask your clinician whether alternatives exist. Also consider medical causes when weight gain is rapid or accompanied by swelling, severe fatigue, cold intolerance, menstrual changes, new stretch marks, or shortness of breath when lying flat. Extra weight is common, but the reasons behind it can be complex. Now let's talk about mindset, because mindset changes adherence. Do not say, I need to lose 50 pounds before this matters. Say, I need to move today because my cells respond today. A single walk after a meal can improve post-meal glucose handling. 1 week of walking can build confidence. 1 month can change fitness. 6 months can change identity. Look at your environment. Put walking shoes near the door. Choose a route before the day becomes busy. Use a timer. Ask someone to join you. If weather is a barrier, have an indoor plan. If time is a barrier, use 10-minute blocks. If pain is a barrier, choose water or cycling. If motivation is a barrier, lower the starting line until it feels almost too easy. Why? Because starting is a biological and behavioral victory. Once your brain believes, I am the type of person who moves, the plan becomes easier to repeat. Aerobic exercise is not a cure for excess weight. It is not a moral test. It is not the whole treatment plan. But it is a strong medical tool because it improves fitness, supports energy balance, reduces cardiometabolic risk, protects function, and helps many people maintain weight loss over time. The key is to match the movement to the person. A 25-year-old with no medical conditions may progress quickly. A 68-year-old with knee arthritis and diabetes needs a different plan. A pregnant person needs guidance specific to pregnancy. Someone recovering from a heart event may need cardiac rehabilitation. Do not copy another person's program blindly. Build your own plan with safety and consistency. So here is your action step. Start with one aerobic activity you can repeat this week. Make it simple. Walk, cycle, swim, dance, or use a machine. Do it at a pace where breathing increases but you can still talk. Begin with 10 to 30 minutes, depending on your starting point. Repeat it 3 to 5 times this week. Write it down. Then build slowly. Pay attention to your body. Ask better questions. How does my breathing feel? How do my joints respond? How is my hunger afterward? How is my sleep? How is my waist changing over time? If symptoms are severe, persistent, or worrying, get professional evaluation. If you have chronic disease, get a safe starting plan. If you take medication that affects heart rate, blood pressure, or blood sugar, ask how exercise changes your monitoring. Being healthier is not about one dramatic workout. It is about repeated signals sent to the body until the body adapts. Start today with the next safe step. Keep it steady. Keep it honest. Keep it medically sensible. Thank you for spending this time with me in Doctor's Corner. Take care of yourself, take care of the people around you, and I'll see you in the next topic.